Hi, it's us again, Laurie and Lisa, and we're going to talk about some of the benefits of breastfeeding. So, why is breast milk so much better than formula? Well, research has shown that breast milk really provides your baby with that extra protection. Everything you've ever had since you were a little girl, every cold, every germ, every virus, you have an antibody to. And you pass that on to your baby to protect your baby from so many different illnesses. But the research has shown that babies that are breastfed have less diarrhea, pneumonia, ear infections. You know, you hear all the time about babies needing or children needing to get tubes in their ears. That's from ear infections, and that can cause hearing loss. But the breast milk actually coats those eustationary tubes in the ear and help to protect it and keep the baby from getting ear infections. Meningitis is another thing research has shown that really decreases in babies who are breastfed. Urinary tract infections, allergies, sudden infant death syndrome. That's where babies, we don't know why, but they just stop breathing in their sleep and pass away. And so breastfeeding really has a protective effect against that in infants. Asthma is also reduced. It keeps your baby from getting sick, unlike formula that doesn't have any of this protection for the baby. It's like giving your baby that vaccine. You know, it really protects the baby.
And you know what else is so really just fascinating about breast milk is the properties of the breast milk change throughout the baby's whole time when they're breastfeeding. So the milk that you're making when they're a newborn progressively changes throughout that time when they're breastfeeding. So it's tailor-made just for your own baby.
Yeah, and that's the one thing that just blows my mind about breast milk is that a mom can have a baby that's born premature and weighs 2 pounds. And if we check her breast milk, it is perfect for that 2-pound baby. It has the right calories, the fat, the protein. And then if mom is sick with something, it has the antibodies in it to protect the baby against what mom is sick. Or if there's somebody around that's hacking and coughing, mom has already had that. Her body recognizes that and then puts the antibodies to protect the baby against that into the milk. It is just amazing. And then when that baby is 2-3 months old and weighs 8-9 pounds, we check that milk again and whammo. It's the right calories, the right fat, the right protein. It changes constantly to meet your baby's growing needs. Other things at breast milk, it's just not the immediate when the baby is breastfeeding that the baby's protected, but research has shown the longer your baby is breastfed, protection lasts them their lifetime. So babies that have been breastfed have less type 1, type 2 diabetes, less ulcerative colitis, less Crohn's disease. So that's amazing that you can protect your baby not just now when you're breastfeeding it, but later in life.
And you know what else I wanted to mention, that we are kind of at almost epidemic proportions with diabetes. So this is something that's very, very important, and the health community is constantly strategizing ways to bring down those risk factors for diabetes. So breastfeeding is a great start.
Right, and one of the reasons they kind of think is because breastfeeding lowers the risk of obesity in children. It lowers blood pressure, it lowers cholesterol in them, and that's something that carries on for them for a lifetime. So it's not just beneficial now, it's beneficial for their entire life if they're breastfed. But it's not just good for babies.
It's also good for you, Mom. It shows that by breastfeeding, it helps hormones to release in your body and contract your uterus after birth, thereby reducing your risk for postpartum hemorrhage. It also can help protect you against premenopausal breast and ovarian cancer. And in this day and age, so many people have been touched by someone that they know, or whether it's an acquaintance or a family member with breast cancer. So just by the act of breastfeeding, it's an added layer of protection for you, especially if you have that history in your family. You should really consider trying to breastfeed for at least 6 months or longer. And it also can delay fertility. So if you are 100% breastfeeding and you're not supplementing with anything else, and baby is gaining weight and thriving and you're not having any issues, it can delay your fertility so that you can have more natural spacing of children. The next thing I want to go over briefly is the risk of giving formula. And yes, I mean that there can be some risks. Obviously, it is designed for infants and newborns, but I don't know about you, but I hear all the time people talking about having to constantly switch to different brands of formula because certain ones don't agree with their baby.
Correct.
And with breast milk, as we said, it's so perfectly matched to meet your baby's needs. There's none of that. Regardless of what is in the bottle, some babies exhibit nipple preference from exposure to that bottle. So you want to make sure that breastfeeding is well established before you even give a baby a bottle, whether it has breast milk in it or formula.
In this day and age, a lot of us, not all, but a lot of us have to go back to work. So eventually your baby is going to need to take a bottle. We're just saying, hold off. The research shows that if you can just give us a good 3 to 4 weeks of exclusive breastfeeding, these babies now know how to breastfeed. So they do great, and then they just go fine right to the bottle. So we rarely have any issues with babies going back and forth once they've learned the skill of breastfeeding.
It's all about building a good foundation with breastfeeding first and then kind of layering these things in. And the example I like to give to moms is if someone throws 2 new things at you at once, you're going to master the one thing that's a little bit easier to do, or it's going to take you longer to get good at both of them. So you want the baby to only know the breast and be really well adjusted before you start that bottle, which would be around 4 weeks, give or take. Giving your baby just one bottle before breastfeeding is well established can make the baby less content with the breastfeeding. Not only do babies sometimes have issues with a different type of nipples going back and forth between breast and bottle, but they also can have issues with the flow rate of the milk. And with breastfeeding, they work a little bit harder. Ultimately, they have better jaw and muscle development from the breastfeeding, so it's a good thing. But they don't have to work as hard from the bottle, and therefore, if they're getting it a lot easier from the bottle, babies can get frustrated on the breast, and we don't want that to happen. And then if you do introduce the formula and there really isn't a medical need, the pediatrician doesn't have any concerns, but you just start doing some formula here and there, you're going to start to lower that level of protection that Laurie had listed for you for the baby. So really, in order for your baby to be best protected, it really needs to be an all breast milk diet if possible. The last thing is it can reduce your milk supply. We see this sometimes where moms are doing both breast and formula, and down the road they start to find their supply starts to dwindle down. So it can affect your supply if it's done incorrectly.
Yeah. So in the beginning, we just recommend that not introducing bottles or formulas in the beginning. It can really reduce the likelihood that breastfeeding is going to go well for you. Babies are less content. You're exposing them to the risk of infections, and it really can decrease a milk supply.
Exactly.
Yeah.
And if there is a need, if the pediatrician does feel that there's a need to supplement the baby, we will go over alternative ways for giving that, either pumped milk, hopefully it's your pumped breast milk, but if not, we'll show you how to do the formula in a different way.
Yep.
Thank you.
Thank you.